Ciao! Welcome to another episode of Richard Harris's Herbal Tutorials. The tutorials that inform and educate about herbs and their uses. The aim of these videos are to bring you common sense and scientific information of how, why, when, and when not to use herbs. They are also to make you understand the method of cooking, dosage, side effect, and other insightful information that are difficult to find. No farcical claims are made, there are no hype or supposition, and you're not being asked to buy anything. Everything is free. I'm just giving information. I'm Richard Harris, a traditional Chinese medical practitioner with over 30 years of clinical experience and a proven track record. In this podcast, I'm deviating a bit from my usual discussions of herbs and their usage, and instead I shall be discussing a very interesting topic. Actually, the suggestion to address this topic was given to me by a few of my patients, some of whom are proud mothers after using the various therapeutic methods that I'm about to discuss in this video. The topic for discussion is infertility. And in this podcast, I'll be discussing this topic from a traditional Chinese medical standpoint. If you want to learn about reggae, you go to Jamaica. If you want to learn about steel pan, you visit Trinidad and Tobago. Logically, if you need to know more about making babies, the best place to start is with the people who make the most babies, the experts, the Indians and the Chinese. Approximately 2.8 billion of them. I guess their numbers are self-explanatory. However, their numbers are not the basis for the treatment that we're discussing. Their treatment works. The proof of the pudding is in the eating. Now that I have your attention, put on your thinking caps and follow me as we embark on another learning extravaganza. What is infertility? Is infertility the same as sterility? Western medicine's view of infertility is defined as the inability to become pregnant after a year or more of regular unprotected sexual intercourse, or the inability to carry the pregnancy full term after conception has taken place. Sterility, on the other hand, is defined as permanent infertility. No fertilization takes place. This video is about infertility and its diagnosis according to traditional Chinese medicine. So please view with an open mind and humility in order to get the essence of what is being discussed. Remember, for skeptics, long before there was Western medicine and science, there were ancient societies and practices that served these societies well and responsible for our being alive today, and for all the advancement we have made as human beings. Traditional Chinese medical thinking divides infertility into two types: primary infertility and secondary infertility. In the first instance, no children has ever been produced, while in the second, there is failure to become pregnant after having previously conceived. This condition can affect both males and females, but I'll only be discussing female infertility in this podcast. Maybe in another podcast, I'll speak about male infertility. Infertility is further subdivided into absolute infertility and relative infertility. Absolute infertility results from congenital issues, which in most cases are very difficult to correct or cannot be corrected, period. While acquired infertility may result from medical issues acquired because of lifestyle, sickness, injury, and a number of unfortunate things humans find to do. In traditional Chinese medicine, the pathogenesis responsible for a woman being unable to conceive are many. A few examples are deficiency of the kidney qi, retention of cold dampness, obstruction of phlegm dampness, heat retention, stagnation of blood, and stagnation of liver qi. Some of these terms are technical terms, and since these podcasts are not treatises on traditional Chinese medicine, I will try as best as possible to without going into too many technicalities, to give some explanation. So for simplicity's sake and for clarity, let us imagine the female reproductive system is an incubator. For the proper functioning of the incubator, the right temperature must be gotten. All the parts of the incubator must be connected. There must be a constant supply of electricity for the incubator to work. The electricity must be evenly distributed. If the temperature is too hot, the eggs will fry. If there's no heat, the eggs won't hatch. If someone consistently turns on and off the current, the eggs wouldn't hatch either. A massive surge in electricity can knock out the system entirely and no fertility. This topic is somewhat lengthy, and as such, there are lots of information relating to it. Therefore, the information will be spreaded over 2 videos, which will be labeled as Infertility Part 1 and Infertility Part 2. They will both be released at the same time but on separate videos. So to get all the relevant information, just look for Part 2 after looking at Part 1. This is the end of Part 1. Please like, share and subscribe. Ciao ciao, fino alla prossima volta. That is, until the next time.